Welcome to today's session. My name is David James. I'm the head of patient projects at Prostate Cancer Research. So thank you all for coming. Many of you who joined us last week, and to those of you who are new, welcome. This is our second session in our Living Well with Prostate Cancer webinar series. I apologize to those who were with us last week, but I just want to give a quick recap of who we are as an organization. Prostate Cancer Research, we're a medical research focused charity that's focused on the prevention, diagnosis, and treatment of advanced prostate cancer and better quality of life outcomes for patients. We're proud to fund 15 high-quality projects right across the UK, from Oxford to London, Cambridge to Cardiff, Newcastle, Norwich, right up to Aberdeen. We have scientists working with a shared aim of developing breakthrough treatments so that we can one day live in a world where people are free from the impact of prostate cancer. Some of these projects which we have going on at the moment, we have some really cutting edge projects looking into using our body's natural immune system to try to destroy prostate cancer. And then we have other scientists who are looking into trying to find a new off switch for prostate cancer by really sort of delving into a protein which should stop cancer from growing. But we also have, as I mentioned last week, we have projects focused on many existing treatments as well, such as hormone therapy and radiotherapy, and how we can look to try to make these treatments better, work better and work longer with fewer side effects. I'm going to take a quick, about a minute or so, to tell you a little bit about one of the newest projects we've just announced funding for. Given the subject of today, prostate cancer and the benefits of physical activity, it felt sort of quite a pertinent one to share with you. So we know that increased fat surrounding the prostate is linked to more aggressive disease and poor treatment response. The fat releases chemical signals, and these signals are actually different in men with obesity compared to lighter men. Some of these signals change cell behavior and may even tell prostate cells to grow, leading to cancer. So Dr. Claire Fletcher and Professor Charlotte Bevan at Imperial College London are going to analyze fat and tumor samples taken from men undergoing prostatectomy. They'll then compare the molecules in the samples from patients with and without obesity and explore how they affect the behavior of lab-grown prostate cancer cells. What they're hoping to uncover are features of aggressive prostate cancers, which could act as targets for new treatments or enable drugs developed for other diseases to be repurposed to treat prostate cancer. Now, by identifying features of aggressive disease, it will actually also enable doctors to detect those patients who need early treatment and those who can avoid treatment and side effects. And this project should ultimately benefit people of all weights, not just those who are obese or overweight. So obviously why we're here today, we launched this webinar series, and as I mentioned, this is the second one, and this is in collaboration with our good friends Tackle Prostate Cancer, who are the UK's National Federation of Prostate Cancer Patient Support Groups. This series runs until January and encompasses a whole variety of topics that we've been told by you, our communities that we strive to support, that you need more and want more support on. So each month we will bring you experts in the fields talking about different topics. So a big thank you to the charity Penny Brohn UK, who are leading this month's sessions. So 4 sessions in total being led by them. I'm going to introduce you to our speaker in a moment, but just a few quick housekeeping points. This is a Zoom webinar rather than a Zoom meeting, so it's a little different for those of you who weren't with us last week. All attendees' microphones and videos are automatically muted, and this is going to allow us to record the session, which is currently underway. And this is so that we can share this session with anyone who might have missed it, and also share this session with you as well. So we will be sharing the session sometime either later today or tomorrow with all attendees and also anyone who wasn't able to make the session. The first 45 minutes or so of this session will be presented by our speaker. And once that's done, we're then going to open up to questions. And we've set aside about 30 minutes to answer as many of your questions as we can. So when the Q&A session does begin, what we're going to try and do to streamline things after last week is, so we're going to try and keep all Q&A to in the chat, not the chat function, I'm sorry, in the Q&A section. So the chat function has been disabled just to try to avoid confusion of some people typing in chat and some in Q&A. So you'll only see a Q&A box, and in that you can type your question that you might have for our speaker. So at any point during the session, feel free to type in your question. We'll then be able to keep a record of that, and then we'll address all those at the end of today's session. So without further ado, I'd just like to hand over to our presenter today, Alisa Burke, who's the physical activity lead at Brohn, UK. Alisa, over to you.
Great, thank you, David, and hello, everybody. So it's a real pleasure to be invited to speak to you all today. I'm the physical activity lead at Brohn, UK, so I'm a colleague of Catherine Zollman, and some of you might have heard her speak last week. So Brohn, UK are a cancer charity, but our focus is to really help support people to find both complementary or lifestyle interventions that might help you and support you alongside any conventional treatment that you may be on. So my area is looking into movement and how all different ways of being active not only can help you feel better and give you, a general better health, but they really have quite specific benefits for prostate and many other types of cancer, which I'll come to today. Before I go to screen share, I just wanted to start today off with a poll that we've put together, just to really get a little feel for what you're all doing in the way of physical activity at the moment. And I'd be really interested, I don't know if David can get that going, to give you a couple of minutes. It is optional, but if you'd like to have a go at the poll, it'd be really good to see what you guys are already doing in terms of physical activity. So we'll give you a few minutes to have a look at that now and enter your responses, please. So there is 3 questions, so do scroll down to find the third. I think David can see the responses coming in, so I'll leave it to you, David, if it looks like the majority have.
Yeah, we're almost there. I think we're going to have 10 more seconds, and then I'll end the poll and share the results with you. So we're closing the poll in 3 seconds. Okay, there we go. And I will share the results now. So I think, Alisa, you can now see that.
Yeah, lovely, brilliant. So thank you, everyone. So looking at question 1 in terms of general moderate intensity activity, we have about half of you already doing more than 150 minutes of that a week, and followed up by not much difference between about 20% doing 30 to 90 minutes, 17% 90 to 150. A few of you, not many, but a few of you inactive, with 3% not doing that level of intense activity at the moment. Question 2, good old pelvic floor exercises, which we'll definitely be mentioning. Not so such a popular activity. So over half of you not doing any pelvic floor exercises, 56%. Second biggest response, 29% of you are doing them 2 or 3 times over a week, but only 8% of you doing them more than 7 times over the week. And I'll be coming to the recommendation for those later on. Question number 3, we have muscle strength training. So a bit more of a mixed response here. 2 to 3 times a week seems to be the most popular by 41%, doing something to strengthen muscles. 37% of you, quite high, surprises me, managing to do 4 times a week or more, and then about 10% either not doing any or maybe just doing once a week. Really good to know and interesting. Well done, thank you. So let me just close that poll, and I'm going to go to share my screen, so bear with me a moment. And we'll just get that playing. There we go. Great. So, today's talk is really about the benefits of physical activity. So I call it movement medicine, and in the world of oncology, it's also been called the underrated wonder drug. So when I talk about physical activity, I very much do see it as a medicine when it comes to cancer. But all the guidelines and recommendations I'm going to come up with today to try and encourage you to see it as a medicine and work out what sort of dose is going to be the right one for you. I very much do see that as when I look at someone or I'm working with someone to decide how much physical activity would be recommended, as seeing as that as part of you as a whole person. So as Catherine, for those of you that saw the talk last week, spoke about, we have this model we use of the image of somebody as really being made up of both the mind, the body, emotions, and spirit. So physical activity mainly comes under body, but for example, if you've got an awful lot going on at the moment, you're feeling very drained, maybe you're reeling from the shock of a diagnosis, you may not, for example, want to have such a high dose of physical activity as perhaps someone where, you know, life's feeling pretty good and they've got good energy, good mental health. Then they might be able to ramp up their amount of physical activity, for example. So it's a very fluid dose. And I just want to put that in there at the beginning, that that dose is very much to be considered as really part of the whole, or the part of the whole in terms of what's going on for your immune system and what's going on for your resilience. Sorry, I'm new to this webinar function and I'm just struggling with how to change my slides. Bear with me. And maybe David, you can help. I seem to be frozen.
Yeah, I think if you just, I'm going to say click on the slide itself, it should hopefully. Okay. There you go. Sorry, I got stuck. So why do we call physical activity medicine, or why is it being called this? So just as I'm going to just throw out a few research examples, but please don't get too overwhelmed and worry about the science terminology. But in some of the biggest research studies, it's shown that with regard to prostate cancer, physical activity, if you, for example, meet the government guidelines, which we'll come to, it can reduce mortality from prostate cancer by at least 30%. And other studies, for example, the one I mentioned below, was a big study by Kenfield, who showed that actually even a modest amount of vigorous exercise resulted in a 49% mortality and a 61% lower risk of prostate cancer death and a 57% slower rate of disease progression. And these are really typical of some of the studies we've seen looking at the link between people who are physically active and cancer outcomes. So there's been this really large and ever-growing body of research in the cancer world looking at physical activity, and whether it's looking at cancer incidence in the first place or cancer recurrence risk, there's some really big numbers coming out, like these numbers of 30 to 50% reduction, for example, in recurrence risk are very typical of what's coming out of some of these big trials. And this is really why
that they're starting to call it exercise medicine or movement medicine, that it seems to really have very significant impact on outcomes. So I've just taken some just quotes from some research from the last 5 years with prostate cancer and exercise in mind. You will get a copy of this, and it has got all the references there. So I'm not going to dig into too much into specific trials, but on the top left there, we have a little picture of some of our immune system cells. And I think that's one of the most interesting ways that physical activity can actually impact on cancer progression. So if you imagine when you're contracting any muscle in your body repeatedly, that muscle contracts and expands as you move. That movement of the muscle creates a release of certain molecules. We call them myokines, but they can be called hope or help molecules. They actually stimulate the immune system to increase their production of natural killer cells as well as T cells, and they also stimulate the effectiveness of that immune system. So that's our front line and our sort of rear guard defenders that we have, if you want to think of your immune system that way. So the other thing that myokines do that's very helpful is they also reduce our general levels of inflammation in the body. So a lot of lifestyle disease develops when that baseline of inflammation in the body gets a bit high. And we really, for general health and to limit the progression of cancer as well as the onset risk of other lifestyle disease, we really want to keep that inflammation level low. So it's really fairly recent discovery from research that muscle is actually acting a bit like an endocrine organ, where every time we use those muscles, they are releasing these very helpful molecules. In these other boxes, we've got physical activity is a really good way of modulating hormones. Sweating is a great way to get rid of excess hormones, for example. Bottom left, there's a little quote here about research that's actually looked at tumor progression. So there is some interesting preliminary research. I think this one was 2017, looking at physical activity, how it can not only help you manage your symptoms from both the cancer and the treatment, which I'll come back to, but it actually can also affect the biology of the tumor and moderate the tumor growth. Bottom right, we've got a quote there. This is some research by Robert Newton, who I will also come back to. He leads a team in Australia who have done an awful lot of work on exercise and prostate cancer. He used to train athletes. He has always worked in sports physiology, and then when his father got prostate cancer, he switched to looking at the link between sport or exercise and prostate cancer, and got some great funding, and so they've done a lot of big research studies out there. So this is a quote from some of his recent research, and I think this was actually last year he published this, and was talking about hormone treatment. So a lot of you may well be on hormone treatment, so it's suppressing testosterone. And yes, that is great, as he says here, for controlling prostate cancer, but it has some probably unwanted side effects, and it can result in loss of muscle and bone mass, increased fat mass, which David has talked about. It's can increase, he says, incidence of metabolic syndrome, cardiovascular disease, and sudden death. Okay, none of that sounds great. But exercise, they have shown in this trial, has been demonstrated to be a very effective medicine for counteracting all of these treatment toxicities. And in fact, even other drugs, some of you may be on, for example, some chemo drugs that are quite toxic and have a negative impact, for example, on heart health, can create some damage there. Again, exercise, heart is a muscle, and exercise can really help counter the impact of some of the toxicity from some of the drugs that are so helpful with for the cancer, but we need something to help us, support us to counter some of these toxic effects. So apart from the benefits that exercise can have on your cancer outcomes, I don't want you to forget that we're still people. We're not all about our cancer, and that exercise has some amazing benefits more broadly. So I've just listed some of the top ones here that I think are relevant, I'm guessing, for the audience today. So side effects of treatment. There are obviously lots of different treatments and all with their corresponding side effects. But one of the most common side effects and the most troublesome ones is fatigue. And fortunately, of all the side effects that exercise can help, research has shown that fatigue is the one that exercise can be most helpful with. And I know that may feel really counterintuitive when it's probably the last thing you feel like if you're really struggling with fatigue. But I say to my clients, really just try and put one foot forward in front of the other, or just start some arm movements while you're sat on the sofa, and maybe just see if you start to move the body, maybe those endorphins or your body's response to that movement might help you to get a 10-minute walk down, or whatever you can manage. Even these small doses of movement can really help with that fatigue. The other big area that exercise I think can be very helpful is around mental health. So, and there's actually lots of different pathways why moving the body can help with our mental health. So this is the one area where actually going out for a walk, cycling, swimming, activities that are just repetitive movements, what we call aerobic or cardiovascular movement. This is where that type of movement is one of the few areas it really wins hands down compared to strength training, which we'll talk at length shortly. So any sort of repetitive movement like that is going to, studies show, is the best way to help reduce everything from anxiety, depression risk, or to help manage depression. It can stave off dementia. So even if you're going to get dementia, it can delay its onset. Studies have shown up to 10 years. And it's not just that we get this buzz from the endorphins and the dopamine hit that we get from exercise, and some people will get more of that than others. But there's some very new research. So again, there's not a great big systematic trial I can quote here, but some interesting researchers. Kelly McGonigal's written a book on this, on the joy of movement. And she's the one that calls it hope molecules to release when we move. But she's looking at the uptake of something called BDNF, brain-derived neurotrophic factor. It crosses the blood-brain barrier. We have lactate, which is that stuff that we blame for sore muscles that gets released when we exercise. But apparently there's also an uptake of that into the brain. And apparently we shouldn't be blaming that. It's not actually the cause of sore muscles. So there's a number of ways that basically chemicals are released when we move the body that do pass the blood-brain barrier, and they can create not only new neurons, but strengthen neuronal pathways, maintain good cognitive function, better memory, and stave off dementia and improve mood. And basically they can help reduce brain inflammation, which is often the cause of long-term depression. So certainly studies have shown that exercise can be certainly as effective as taking medication for depression, for example. It's not to say to come off, please don't suddenly come off any medication that you're on. Physical activity could actually help support the effectiveness of that medication. And it's definitely something you'd want to talk to with your doctor if you are trying to come off medication, but it certainly can be as effective. So my favorite topic, number 3, resistance exercise or muscle strength training exercise. So in terms of physiological or physical benefits, that type of exercise, doing something where your muscles having to work against some sort of resistance, is going to get you most of these physical benefits. So, there's such a huge long list. I've only put a few of the obvious ones here, but obviously if we can train those muscles, they're going to increase in size and quality. It will make you stronger, so life just feels a bit easier, more powerful. And then there's these other benefits you may not have thought about. So muscle acts a bit like a sink and absorbs sugar from the blood glucose. And we really want that for a number of reasons. We're really trying to control our blood sugar as best as possible so that we don't get these sort of highs and lows over the day. Not only will we feel better, but that will really lead to better longevity and reduced risk of things like diabetes. And in fact, high blood glucose is the third highest risk factor for all-cause mortality in the world. So if everyone could control their blood sugar much better, we would see a significant reduction in or a significant increase in longevity, reduction in all-cause mortality. So when you're on hormone deprivation treatment or androgen deprivation treatment, ADT, you'll see me refer to it as, it is harder to gain that muscle mass, but I just want to reassure you that if you can stick to it, and it is all about consistency, doing something for muscle strength training every week, then, for example, as this study shows, after 3 to 6 months, this particular study showed that they did measure significant improvements in body composition, i.e. a reduction in body fat and an increase in this muscle mass that we want. And I've quoted there again, that's another piece of research at the end there by Robert Newton in Australia, showing that if possible, do start your exercise, or if you're not already active, right at the onset of your hormone treatment. In that study, he also does say that up to even 6 months into treatment, it will still be very protective in terms of help you not lose that muscle mass. So you're not having such a big step back to have to work from to build up your strength again. So basically, as soon as possible, do make sure you're doing some training, particularly strength training, and especially if you're on hormone treatment. And then just to finish that slide, we've got some other benefits down there that a lot of people find exercise a great way to manage stress, manage their cholesterol, reduce visceral fat, that deep internal fat around the organs that's linked to unwanted health outcomes. Strength exercise or impact exercise, really good for maintaining your bone density, which might be affected by treatments. It also will naturally degenerate as we age. Exercise does help people feel more resilient, manage that anxiety, and if you can strengthen your muscles down the back of the body in particular, you can also really improve your posture, which in our modern world is definitely something most of us are needing. So how do we get these lovely benefits that I'm talking about? So this is a little chart. It's the updated sort of guidelines for physical activity. And these are actually the same guidelines as the health bodies, the main health bodies in the UK and the States, for example, would recommend, even for someone with a cancer diagnosis. So that doesn't change anything. There may be some specific considerations to take on board, but this is kind of still the gold standard of what to aim for. So I actually think this is quite a good little summary here. So at the top there, they have summarized some of the benefits I've just gone through. But if you look at the sort of green bit and below, this is what we're sort of, if we waved our magic wand, we'd love everyone to be doing if they are able to. So there you've got your 150 minutes of moderate intensity activity per week. And by moderate intensity, it's like in that poll we did, it's just something where it's a bit like a brisk walk, like you see the bus, but you're carrying shopping, so you can't run, so you just try and walk as briskly as you can to get to the bus stop in time. It's a kind of 7 out of 10 in terms of how intense it feels to you. So we're looking to try and over the week get to a total of 150 minutes. In the brown circle, we've got what researchers call the forgotten guideline. This is that strength training, so doing something for muscle strength at least twice a week. For my clients, I say 2 to 3 times is ideal in terms of the time it takes for muscle to rebuild. it works out about every 3 days we should be doing something for muscle strength. If you are more elderly or have issues with balance, we also want to look at balance training. So even if that's just practicing standing on one leg, and also maintaining your flexibility. And none of that's going to be doing you any good if we spend the rest of our day sat down. So some interesting research has led to this guideline, which again is very forgotten, that actually inactivity is now seen as a health risk in itself. So you could be, for example, doing an hour's exercise first thing in the morning at 7 a.m., but apparently 8 to 9 hours is the cutoff for how long you're allowed to sit down for over the day. Some big research going on in Glasgow has shown that beyond that, there is a real, that's a health risk in its own right. So you wouldn't want to exercise for an hour and end up sitting 10 to 12 hours at your desk, which I know it sounds excessive, but I know for some people with long hours in the office, that might be the case. So really trying to break up any periods of sort of sitting or even standing without moving. It's all about moving and breaking up sedentary periods. So when it comes to prostate cancer, those are the guidelines, but I would definitely add in pelvic floor interventions, which we're going to come to. But there's a few qualifications I just want to mention about these guidelines. So I called them the 4 buts. They're my 4 buts. They're just the 4 things I want to highlight. So the first one is about, it comes from this team up in Glasgow. So you may have seen Professor Jason Gill on television. He heads up the research team up there. He's been on TV. He's also one of the people that actually put together the UK government guidelines for exercise. And he's now saying that he would actually like to change those guidelines to make them actually a bit less onerous. And the reason is, he says, when they made those guidelines, they didn't have the recent trackers and so on that we now use. And that people are actually very bad at estimating how much exercise they do. So what was happening is people were overestimating how much exercise they were doing, but the researchers took it as that was correct, and they thought, right, well, they need to do this 150 minutes to get these benefits that we're seeing. But apparently they weren't actually doing 150 minutes. Now that they've stuck trackers on people, they realize that they don't need to do 150 minutes. If they actually did about half of that, for example, of truly moderate intensity activity, they would get these benefits that we're talking about, the reductions in disease risk and so forth. So one of his studies showed that if you actually did about 20 minutes of strength exercises a week, so one session of 20 minutes, but you chose an exercise for each of your main muscle groups, but you really did it at an intensity that by the end of that set, if you like, that the amount of push-ups or leg presses or squats you did that you really could hardly do anymore, and you did that intensity for each exercise and just did that one good session a week, you would get about 70% of the benefits, as if you did as many of those exercises as you could over the week. So it's all about a sort of quality dose of exercise will get you the lion's share of these benefits. So don't feel you have to get up to being able to allocate the 150 minutes. The second but is that bear in mind all these big research studies are generally done on early stage prostate cancer or breast cancer, just because they're the most popular common cancers, and they do them on early stage, obviously, because they want the population to be able to do the exercise trial and feel well enough to do so. So they may not be suitable, these guidelines, for you where you're at. Maybe you have other health considerations. So please do check with your consultants and your exercise. You may need some exercise advice or supervision. But number 3, although we keep talking about aerobic exercise and resistance exercise in the guidelines, that's really because research is very expensive to fund. And when people do get funding, they pick to look at aerobic and strength training exercise because they, that's tradition, that's what most people do. But there hasn't been the big funding to look at some more unusual, unusual movement forms, particularly I'm very interested in some of the more gentle movement forms like yoga, qigong, Tai Chi, dance, just stretching the body. So it's not to say that these other movement forms may not get these amazing results, just that the research isn't there, hasn't been funded. But number 4, but there is now a big move from, now that there's sort of categorical evidence of the benefits of physical activity, they are now looking at cancer type specific research. And they are starting to look at, okay, well, how intense do we need to be exercising? But at the moment, again, there isn't that research to really say, is it worth the slightly higher risk of injury, for example, of doing high intensity activity versus moderate level activity? There's some small trials, but there just isn't the evidence to give a recommendation. They have got in the guidelines that vigorous activity is helpful, but they can't really say how much, how to do HIIT training and exactly how to do that. It is very individual, but I'm happy to perhaps talk about that a bit more at the end. So just a reminder here, so we're sort of saying that those are the guidelines, but it is very individual, will really depend on where you're at, your exercise history. Remember that sort of holistic wheel of mind, body, emotion, spirit. I will always have that in mind when I'm doing exercise prescription for someone. Where's their energy levels? How's their sleep? Are they getting ill? Lots of coughs and colds a lot, or do they have a strong immune system? Are they under treatment, etc., etc.? So it is very individual, and please do seek help and support, which I'll come to how you can do that if you're not sure what to do and whether it's safe for you to do something exercise-wise. But generally, we're aiming to tick these 3 boxes. So we've got resistance exercise there, including pelvic floor, which we're going to do in a moment. We've got aerobic, that repetitive movement in the middle, and trying to keep up your balance and your flexibility is also not to be forgotten. So build up from where you're at in small stages. There's a nice little reminder here that age is not a barrier. There's a big trial going on up in Manchester currently. It started in 2019. It was a prehab trial, so looking at getting people fit ahead of their treatment and surgery. They invited 2,000 patients, and 711 of those were over 70. 94% did take up the offer and joined this exercise program, and they showed significant positive improvements in their. So the sit to stand is basically getting up off a chair and sitting back down without using your hands and seeing how many times you can do that in a minute. So they increased the number they could do by 7. So that's a measure of their lower body muscular endurance. And they increased their sort of confidence in what they're able to do physically. There's a measure of how we do that from 61 to 72. So bearing in mind that the majority of those people, those men, were over 70. So pelvic floor exercises. Let me just take a little sip. So in that poll at the beginning, not many of you are actually doing these. So I think this would be a really important area for some of you to perhaps just get a little bit more informed about and reflect whether that might be something you might want to try and see whether it helps with helps you feel better and improves any detrimental side effects you're experiencing from surgery or treatment. So I've given you the link here, so you can you'll get a copy of this recording, so you'll have that resource there. But it's I liked that link. It has a nice little list of how to do the exercises. I've taken this little picture diagram from there. So just looking at the diagram, so this in grey is your pelvic floor. So it's like a sling. It's actually a muscle, and it goes from back to front. And we can train it like a muscle. So the more we can contract it and relax, contract, relax, we will strengthen it like we would train our biceps. So it's the same idea. And it can be really important for lots of reasons. Everything from sexual function to urinary issues. And just generally, as we age, that pelvic floor muscle gets weaker, like we lose muscle mass As we age, we lose up to, when we get over 70, we lose up to 3% of our muscle a year unless we do something about it. So anyway, as we age, we want to really train the pelvic floor. But if we have had prostate surgery, we're on treatment, we've had radiotherapy, there's other reasons that our pelvic floor might well be weaker. It isn't necessarily the case. So some people, particularly some men, can actually have a too strong a pelvic tone, we call it, and they don't often, they can't so easily relax their pelvic floor. So it doesn't necessarily apply to you that your pelvic floor is weak and could do with strengthening. One sort of test of that would be when you urinate, can you stop the flow of urine midway? Please don't try that too often, no more than, say, once every 2 weeks, if you want to see, do that as a bit of a test for your pelvic floor strength, because it can cause, bladder issues if we try that too often. So that comes with a health warning, but that will give you some idea on the strength of your pelvic floor. So apart from things like urinary issues, not being able to fully empty the bladder, dribbling, sexual function, and so on, it's also very important to be able to connect with the pelvic floor and engage those muscles when we want. They also, because they connect with our abdominal muscles, which are like loops. So it's, it doesn't just, like all of our body, it doesn't act in isolation. So what I'd love everyone to do is be able to contract their pelvic floor on demand and be able to contract their, what I call core muscles, their deep abdominal muscles, and basically be able to contract your pelvic floor and your abdominal muscles a little bit every time we're moving, and even when we're, say, standing. So let's just have a little practice so we know what we're all talking about. So if you want to stay seated, that's fine. If you want to stand up, you can join me standing. Either way, you wouldn't want your thighs close together. So standing or seated with your feet at least hip width apart and your feet flat on the floor. And just take a nice deep breath and bring your awareness to the body. And we're just going to try and isolate the pelvic floor to start with. So just have a go at trying to contract or squeeze your pelvic floor. So imagining that sling of muscle from back to front. So it's a bit like you might feel sort of testicles move up a bit. It's almost like you're also simultaneously trying to not pass wind at the same time. You might feel all these other muscles in the body contract, like the buttocks and the tummy. Don't worry about that for now, but we're trying to isolate just the pelvic floor. Give it a little squeeze on and contract, and relax. So now just fully relax and let it go. Maybe that moment you relax, you can feel if it was actually working. So maybe try that one more time, squeezing up the pelvic floor. Remember, right the way from back to front. Trying to keep breathing, don't hold your breath, and relax. And then we're going to do it one more time, but this time we're going to add in these core muscles. So imagine you've got a donut around your tummy button, and you're trying to bring that donut or that tummy button area in towards your spine. And then imagine you're wearing a little weightlifter's belt. It's a small one though, it's quite close to your spine, and you're trying to tighten it from back to front. So now we're going to try and contract all these things at the same time. So we're going to squeeze up the pelvic floor and try and squeeze in that donut towards your back, towards your spine. And imagine you're tightening that weightlifter's belt so your torso becomes a bit firmer and more toned than normal. And release everything, relax all that musculature. One more time, squeeze it on, squeeze, 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 tummy in, pelvic floor up. Doesn't have to be as hard as you possibly could, but it needs to be about, say, at least 50% of how hard you could do it. And relax. So some of you might find it almost easier trying to do the tummy muscles with the pelvic floor. Again, we can come back to these at question time, but on that link, it will talk you through both what we call fast twitch and also slow twitch squeezes. So we can either just squeeze for a second and release, or we can try and hold those muscles tighter for up to 10 seconds, but we never want to do too many at once. So when you feel those muscles tiring, you would stop. So you might just do 5 1-second squeezes and 1 or 2 10-second squeezes, and that might be enough as a practice. But the recommendation is, for if you think it would benefit you to strengthen your pelvic floor, to do that 3 times a day, every day, maybe before or after every meal. So looking at the poll, it might definitely be an area that you might want to give that a go and just see over time what benefits that might bring for you. So I've just put a little action slide in here. So I'm also trained as a coach, and when we coach people, at the end of a session, we'd always say, right, you know, what's the action you're going to go away with, or what's the practice you want to commit to? So if there's something I've already said that sparked an idea for something you want to try, it might be talking to your physio about your pelvic floor health. There's ways they can help you measure it, or you might want to commit to a practice. Do perhaps just jot that down. And then here's just a nice little diagram I found. It was in the New Scientist magazine last year. They did an article on strength training, the underrated aspect of fitness. So it's just to really give you some ideas of activities that do strengthen muscles. So at the front here, you've got a lady just sat down, but she's sitting with a nice upright position. So her muscles in her trunk are working quite hard to maintain her body, particularly because she sat on that, I call it a Swiss ball, like inflatable ball. It's a bit unstable. So your muscles are going to work hard to keep you upright on top of that. We've got at the back there, you have got 2 people exercising, doing squats, and the other person's doing lunges with a bicep curl. And you can see the muscles that those target. The very back, you've got a lady lifting a baby. So when we lift things, we're working the muscles in our arms and shoulders and back. We've got a man vacuuming. Again, he's using his chest muscles and his arms. And we have an elderly man walking up the stairs. So yeah, stair climbing, hill climbing is going to be great to strengthen the legs, but also brings in the big muscles we have in our buttocks, the glutes. So it doesn't have to be going to the gym. Maybe there's things that you can do at home or as daily activities that will strengthen muscle. So a few tips on, you know, how do you sort of apply this to you from where you're at now? So lots of you, it look like, are doing lots of physical activity already, but wherever you're at, if you do a bit more, it is dose dependent. You will get more of these benefits up to a point, which we could talk about at the end, but you'd have to do an awful lot of exercise to do too much. The first thing you would build up is frequency. So if you think of exercise sessions as doses, you want to build up to doing lots of little doses over your week, even if that's just 5-minute doses, that counts. And when you've got lots of doses in over your week, and that becomes a regular part of your routine, then you'd build up the duration of those exercise sessions. And then lastly, you'd build up the intensity once you've really got those sessions nicely in routine in your week. And remembering not to be sedentary in between for too long at least. So again, you might want to write down anything that's come to mind that you want to commit to in terms of any changes you want to make to your physical activity. And remembering that it's the people who are currently doing the least who have got the most to gain. Remember that 20-minute study, just going from 0 to 5 minutes a week can bring you some really great benefits. So I've got just a few sort of very specific, I'm aware of the time's flying by, just to say there are a few considerations to do with prostate cancer specifically. One is that, yes, belly fat will be helped a little bit. So generally fat reduction can be helped by exercise, but it's going to be mainly diet that will help you with weight loss and fat reduction, unless you're able to do really quite intense activity or an awful lot of it. So yeah, erectile dysfunction, sexual function, mixed research whether exercise can help, but in the cancer population, because of the variety of treatments and surgeries, it does depend what surgery you've had done, but certainly in the general population, exercise, there is evidence for exercise helping with erectile dysfunction, for example. Urinary problems, I've put, there is again some good research, but there are also an awful lot of complementary therapies that have had some really good benefits, such as acupuncture, hypnotherapy, and so on, and what we call bladder retraining, working with you with the anxiety around urinary problems can really help. Bone met. So if you have got bone metastases, please speak to an exercise specialist who specializes or has that qualification to work with someone with cancer, or a physio. Your risk is fracture. We don't want you jumping up and down off boxes or twisting around the area. You've got the bone mets, but we do want you exercising. So please do get advice. And lymphedema, that's when we get swelling because our lymph system gets a bit blocked after surgery or radiotherapy. So again, we do want you exercising, but you would, if you've got a flare up, want to be wearing a compression garment. And there are things you can do to help that flow of lymph to reduce the inflammation, what we call lymphedema exercises. So again, we do want you exercising with that, but please get advice. So let me just see if we've got time. I don't think we've got, I think I'm going to save time for questions. There's a really good 3-minute video here by this man, Rob Newton in Australia, his team. We could play it at the end of questions if you want to see how the questions go, but if not, do come back to this recording of the video or look that up. It's a really nice video to show people with prostate cancer in Australia talking about the exercise program they've been on and the benefits they've found.
Alisa, I'll send that link round, just to let everyone know. I'll send that link round in the follow-up email to this session. So if we don't have time, everyone will get it in their email by tomorrow.
Lovely. Yeah, it's that's the video there. So let me just work out how to get back to my slides. There's my messy screen. Sorry, I've lost my.
Shall I launch the final poll whilst we wait?
Yeah, I don't know why I can't get it back. Thanks.
Sure. So we're just going to be doing one more poll now. Just really want to see, hopefully, if anything here has changed your plans for the next 7 days. So we'll just have this open for a minute or so, and then we'll move on to questions. Great, and I'll close the poll in 5 seconds. Thank you very much, everyone, for answering that. So what I'll do now, I'll share the results, but Alisa, I've actually got the old results open on my screen as well. So maybe what I can do is tell you, in the first poll, we have seen an increase from about 49% to 56% of people said they're going to aim for more than 150 minutes. We've seen an increase from 17% to 26% of the 90 to 150 minute category, and then obviously a decrease in all the lower categories as well. So that's really great to hear. In the second poll around pelvic floor exercises, it sounds like you have convinced a lot of the people who weren't doing it. So we've gone from 56% of people saying they have done none in the past week to just 6% saying that they don't think they will be doing any in the coming week. And then we've got 36% who will do it 2 to 3 times a week, 32% saying 4 to 7 times a week, and up from 8%, right up to 26% who say they'll be doing it more than 7 times over the week. So that's really great to hear.
Brilliant, thank you.
And then finally, on the last one, in terms of more vigorous activities, we have 4 times or more. We have gone from 37% up to 47%. We've seen a decrease in none and once. So jointly about 1 in 4 now to about 1 in 10. So a good drop there. And then about the same, saying 2 to 3 times a week. So really good to hear that you're feeling much more inspired to go out and do some exercise of various types. We will be sharing, as we mentioned, all of this with you as well. So hopefully you can get some more tips from that. But we'll now move on to questions. We have quite a few questions to go through. So I'll read them out to you if that's all right, Alisa, and then you can go. So the first one was from Andy. So surely those who are more able to do more exercise are those that are less likely to die earlier from cancer, i.e., is it not because they do exercise, it is because they're capable of doing it?
So just read the last part of the question. I get the first bit.
Is it not because they do exercise? Is it because they're capable of doing it? Is it the fact they were already able to do it in the first place rather than they're going out and doing it?
Yeah, I'm not sure about the word capable. Doesn't sit well with me, because I think there's always something everyone can be doing, which is kind of my point about the gentle movement, like even stretching. There's some interesting research that stretching the connective tissues releases these very helpful molecules. So, you know, I'm sure genetically, yes, there are some people more predisposed to, you know, being athletes and better performance. And so, yes, those already exercising will have a lot of the benefits supporting them, all that exercise that they have done. But I think the point I'm trying to get across is that for those that aren't doing a lot or don't feel they're able to do a lot, the small amounts they can do will still get them some really good results in terms of both cancer outcomes, reducing lifestyle disease risk, and just quality of life and living life well. And if you can't manage the guidelines and you can't manage to do, you know, to get outside and walk, or you're shielding and so on, you know, even stretching, gentle movement at home, doing 10 sit down stand ups while the kettle's boiling will all add up and will help. I'm not sure if that's really answering the question.
I think that sounded great to me. But if Andy, if you
there's a follow-up, come back
to type again. So the next question we have is, one of your slides indicated that physical activity can delay disease progression. I've been told that prostate cancer is slow to progress. Does this mean that physical activity can actually almost stop it progressing entirely?
Well, yes and no. So yes, I mean, luckily prostate cancer is one of the slowest growing ones, and actually it's most often, in many cases, it isn't what is going to kill you, to put it bluntly. So, and certainly some, I've worked with both anecdotally and from the research. I know anecdotally I've worked with people who have been given, you know, a certain time left to live. They're stage 4, and they have way exceeded all expectations. Sadly, not all oncologists are very interested on how they manage to do that, but often it's from adding in heavy weight training, for example. That most of those weren't prostate cancer cases, because prostate cancer, I agree, it's very slow growing, and it's when it starts obviously metastasizing, or you get secondary cancers that things can speed up. So you know, yes, whether it actually stops growing or just keeps growing but slower, you know, there isn't enough research and I can't answer that. But certainly 3 hours, there's a consensus on the research that generally for those most common cancers, 3 hours of moderate intensity activity a week reduces, well, they call it recurrence risk, by 30%, and 5 hours a week, 50% reduction in recurrence risk. So it's also dose dependent on how much you're doing. And yes, it can really slow things down, or just, I know plenty of people who just live with their cancer and it's completely stable for decades. So it is possible to stop it progressing, but I can't make promises, and it's going to be very individual.
Thank you for that. And so we have a question. This is around, what if I can't do much exercise due to the pain it causes? I actually finished treatment 12 to 18 months ago, but still have pain.
Yeah, chronic pain, gosh, I empathize. That must be horrific. And I do see it a lot, though. First port of call is to make sure you've done what you can. You've been referred to a pain clinic, you explored what they can do to help you with the pain. From a complementary point of view, acupuncture has shown some really great results with pain management, and they use it a lot in oncology centers around the world, and in London, I think now some offer it, even to the point they use it during surgery to support or instead of anesthesia. Like I mentioned to the previous question, whatever you can do will get results. So stretching, doing what you can that's not going to exacerbate the pain. There's not particularly research showing that exercise or movement is going to help with the pain. It does help with that sort of uncomfortable feeling of stiffness and aching joints, but chronic pain is quite another level. So I can't promise magic results for the pain, but if you can find something that doesn't exacerbate the pain, then you will get the benefits from exercise. But it doesn't have to be getting the heart rate up. It could be doing gentle yoga, stretching, maybe some really gentle qigong. And we do offer things like that through Penny Brohn, which you're welcome to join us online and just give it a go. Or even just joining one of our wellbeing groups and doing some breathing practices and things that are going to soothe the nervous system might be enough for you, but you're still at least training the diaphragm and moving, even if it's pelvic floor squeezes, they're all still, it's still movement in the body.
We have another question from Roger. So given the rather alarming side effects of testosterone deprivation, does exercising increase the testosterone level and so negate the effects of hormonal treatment? Yeah, no,
I know it's a complicated one, and I've struggled to get my head around that with testosterone. And the more I look into it, the more I realize how complex it is. From what I understand, and I'm not a scientist, but in the acute moment that you're doing exercise, you will get an incremental increase in testosterone, but only for the duration or very shortly after that exercise, after which it comes back down. So you're not going to increase your general levels of testosterone, but when you talk about testosterone, you also need to look at levels of free testosterone and how much sex hormone binding globulin, and there's lots of other, not confounding factors that actually, when we're talking about testosterone levels, I think if you were not on hormone treatment and you were a bodybuilder and you spent most of your life in the gym building massive muscles, you will increase the amount of testosterone in your body. But although a lot of them do it through supplements to stimulate that, but at the levels of exercise we're talking at, and because of the difficulty in gaining muscle when you're on that treatment, your exercise is certainly recommended. It's not countering, and it's definitely going to support you while you're on your hormone treatment.
We have a few questions I'm going to sort of merge together now. So we have some questions around different types of exercise. So what type of dancing is best, would you recommend? How good would you rate cycling as an exercise? And how well does playing golf sort of feature in sort of recommended levels of exercise?
Ooh, lovely questions. So dance is, it's going to be really individual, but dance has some surprisingly positive benefits. Again, if you look at something like the work of Kelly McGonigal, her recent book, I think it's called The Joy of Movement, there's something about moving the body with other people, with music, and with having to use our brains, i.e. learn a set of moves or a sequence of moves, brings in those extra benefits so that we get extra brain benefits, we get extra mood benefits, mental health benefits. obviously because of that sense of community. You know, we're human, we're programmed to connect, we seek connection with other human beings. There's something about music, doing something in unison with music, like the research on singing in choirs shows of all the things that stimulate the happiness parts of the brain, singing in a choir wins hands down. Dance isn't far behind to music in a group. So yeah, there's some, you know, it may be hard to tease apart those different factors, but I'd say, you know, ideally doing some dance with other people, with music is great. But some people might prefer to do something very expressive, but, you know, definitely get the music in there. That can really, really help. And quite how you move your body when you dance, you know, that's really up to you. But there would be a whole nother talk. I've done a lot of training in what's called embodiment facilitation, which means you can change how you are by how we move our body. So if there is a quality or characteristic you would like more of, you know, for example, you'd like to be more confident and grounded and less anxious, then big sort of stomping African dance type movement, so really grounding, earthy movement, might help you get more of that quality that you'd like in your life. So that might just be something to think of with dance, you know, move in the way that you'd like to have more of that quality in your life. Cycling, I'm a big cyclist. I teach spin cycling. It's great for people with, you know, dicky knees and hips, things like that, but you're not going to get the impact. So it doesn't do anything for bone density. Just bear that in mind. You'd have to do something on top of that for bone density. Again, it's great, it gets you outdoors. There has been some studies by Robert Thomas. So he's an oncologist who's also a sports physiologist in Cambridge, who runs the Primrose research trials there. And he, I'd have to dig it out. He did show that there were some adverse effects. I need to go and look at this, but adverse effects from the point of view of prostate cancer in spending too much saddle time. So I'll have to come back to you on that one. I can't remember what it was, the facts, but you could look that up. Robert Thomas is his name. And golf, you know, again, fantastic. It's social, you get outdoors. Just be careful. The risk with golf, funnily enough, is that swing, bringing the arm across the body, compresses the blood supply to the heart. If you've had some heart damage from chemo, or you know you've got coronary heart disease, do get your heart checked out. People do drop dead on golf courses from heart problems. So I hate to put that in there, but I am just going to add that little warning. But obviously, overall, it's a very popular sport, really lovely to be outdoors and sociable. So yeah, if you love it, do it.
We have some questions around sort of actually muscle building. So I'll sort of group a couple together. So does actual muscle building sessions count towards that moderate 150 minutes of exercise, or is it additional to? And you know, what sort of, you know, in terms of muscle recovery period, you know, what sort of, you know, what's an ideal period of time to kind of let your muscles recover after some muscle building sessions?
Good, yeah, good question. So yes, in the guidelines, the muscle building time is part of your 150 minutes. So say if you did 2 25-minute sessions a week of muscle building, plus a warm up and cool down, then that's 50 minutes done. Then you've got 100 minutes to try and aim for of your other moderate activity, whether that's gardening or cycling, dancing, etc. In terms of recovery time, if you are doing an intensity of muscle strength exercises or activities where the next day or two you really are feeling that muscle soreness, that you really feel you've used those muscles, then they do need a couple of days to recover. So every time we push or pull against something, carry something to the bonfire, our muscles, we make these micro little tears in the muscle. So it's a slightly inflammatory process. Over time, it reduces our inflammation, but in that moment, it's inflammatory. And we need time for those little tears to repair and rebuild. And they either rebuild so the fibers become a bit thicker, or we build more fibers. So either way or both ways, our muscles then get bigger. If you imagine our muscles like a a bag of spaghetti, and the spaghetti's all these fibers lined up. We can either grow new strands of spaghetti, or those strands of spaghetti will get thicker. So that whole process of the tears and then rebuilding or making new muscles are going to take about 2 to 3 days. That's why we say muscle strength exercises 2 to 3 times a week. But if you're just doing 5 minutes a day or something fairly light, that you're not really feeling that muscle stiffness, then it's okay to do a little bit every day, just to maintain your muscle strength. But if you're really looking to go a bit more intense, then I would give it a day or two, not train back 2 days back to back.
And then we've got, I think, 3 or 4 more questions, which we'll try and squeeze into the last few minutes. So around pelvic floor exercises, again, I'll group a few together. I was under the impression that trying to stop peeing actually improved pelvic floor muscle tone. Have I been informed incorrectly? How do you know whether your pelvic floor muscles are already strong enough and you don't need to exercise them? And are pelvic tilts and thrusts useful?
Right, great. If, I would, the recommendation is not to do the trying to stop the flow of urine. From my training, I'm told that to tell people not to do that more than once every couple of weeks. It's not the best way. It's a test. It's not the way to train, because we want to completely empty the bladder. And I think the issue is we can, it doesn't encourage full bladder emptying to sort of try and keep stopping peeing as we pee. But check that out maybe with your doctor or your physio. How if you're not having to get up a lot in the night to pee, you don't have issues with strength of the flow of urine, leakage, good sexual function you're happy with, then your pelvic floor strength is probably fine. But more often than not, certainly the men I've worked with, they sort of put up with a lot of these concerns, which are affecting their quality of life, their lifestyle, thinking it's just something they have to put up with because of their treatment or their diagnosis, but they're not doing any pelvic floor exercises. So, I'd say the majority, it's the opposite, that actually you don't have to put up with all of that. We do really need to practice, engaging, really squeezing those pelvic floor muscles. There's an NHS app called Squeezy, which you can download. It does cost, I think, a couple of pounds, but then you have it and it has reminders. It has a little wheel that lights up to time the squeezes, does the slow ones, the fast ones, so that you could get some support that way. There was a third aspect of the question. Have I answered that, or I can't?
It was around pelvic tilts and thrusts.
Oh yeah. So that's kind of just like the next progression. So if you join, like at Penny Brohn, we do online classes, and so we will practice pelvic tilts. So that's when we're engaging our tummy muscles. We might have drawn up our pelvic floor, and then we actually use those muscles to tilt the pelvis. Maybe then we go up into a hip bridge, for example, but it's kind of the next progression. It's learning to move the body with those core muscles and the pelvic floor muscles working. If you remember what I said, we want those engaged, say 25% all the time that we're moving. So it doesn't have to be squeezing them on as hard as you can, but if you keep them a little bit engaged as you move, it's going to be, functionally, you're going to move better and support your spine. And pelvic tilts and so on are great. They're just a progression to building up into practicing moving, keeping those muscles engaged. That's how I see it.
And we've got time for one more question, and then Val and Andy, I know we haven't come to yours, but if it's all right, I'll ask Alisa, maybe we just type up a question and I'll get those emailed to you after the session. So no worries, we will get to you. So the final question was from Peter, who's was asking, he said he put on weight since having hormone therapy, which started 2 years ago, but it's now finished. Will his weight get better if he actually increases his activity? And are there ways that he could help reduce the effects of hot flushes?
Oh, great. So yeah, actually, gosh, short answers. So the weight one, through exercise, unfortunately, our brain has this very naughty habit that when we move, it just makes us eat a bit more. So either trying to add in some intervals of more intense exercise has shown to help with weight loss. There's been some good studies there, but really it comes from diet, sort of doing a nice low glycemic load diet, like really moderating your blood sugar, you know, cutting down the carbs a bit, having a nice steady dose of protein throughout the day, lots of vegetables and so on. It does become a little bit more nutrition for weight loss. Hot flushes, exercise does help. Again, we don't want to do perhaps long doses of endurance exercise, but again, trying interval training, trying strength training. And then there's some lovely, I work with a lot of clients who, I'm not a herbalist, but I'm menopausal, so I've looked into this. There's some herbs that are very safe to use, which you can just sip as teas over the day, which can help with hot flushes. But maybe if Andy wants to get in touch directly, I can put him in touch with some ideas there.
Brilliant. Well, thank you so much to everyone for joining today, and a big thank you to Alisa for that really wonderful talk and for answering all those questions.